Hey there, and welcome to The Explainer. I am so glad you're joining us today. Navigating the whole world of reproductive health, it can honestly feel like you're trying to learn a completely new language, especially if you're just starting to think about having a family, or maybe you've been trying for a while and you're out there searching for some answers. Well, today, we're going to break down one of the absolute most foundational concepts in fertility care, and that is ovarian reserve testing. We're going to walk through this step by step together to make the whole thing incredibly clear, manageable, and honestly, a lot less scary. So, if you're sitting there feeling completely overwhelmed right now by the mere idea of fertility testing, I want you to go ahead and take a really deep breath. Validation is just so incredibly important here. It is completely 100% normal to feel anxious or stressed out when you start looking into these tests. I mean, this is a deeply personal journey, right? And it's packed with all this complex medical jargon that can make an already emotional time feel, well, even more intimidating. So if you are feeling that weight on your shoulders right now, please know that you are absolutely not alone. Taking that very first step into a fertility clinic, or even just sitting on your couch doing the initial research online, it can feel incredibly daunting. But you really don't have to do it by yourself. Think of this explainer as your supportive guide. We are stepping into this topic together to take all of those complicated medical terms and translate them into plain, helpful insights that you can actually use. Our big goal today is to replace that anxiety with real understanding, piece by piece. All right, let's build our foundation. What exactly is an ovarian reserve? Well, simply put, it's the quantity of eggs a woman currently has left in her ovaries at any given age. And this reserve is super important because it directly impacts your ability to conceive, whether you're trying naturally or with some medical assistance. The really crucial thing to understand here is this. As the quantity of eggs naturally reduces over time, the quality of those eggs often goes down as well. And that is exactly why doctors use ovarian reserve testing. It's this fantastic proactive tool to figure out exactly where you currently stand in your reproductive timeline. So how do we actually measure this reserve? Well, clinics use this wonderful, really comprehensive two-pronged approach. Basically, it involves biochemical blood tests, which look at specific hormone levels like FSH, estradiol, and AMH. And they combine that with ultrasound imaging, specifically something called an antral follicle count, or AFC. By looking at what's happening biochemically in your blood, alongside a physical look at your ovaries, your doctor gets a highly accurate, complete picture of your overall reproductive health. It really just takes the guesswork right out of the equation. Okay, let's dive into this, because the natural process here is actually pretty fascinating. To truly understand what those blood tests are looking for, we have to look at this beautiful teamwork happening between your brain and your ovaries. This is usually measured right at the start of your menstrual cycle, like on day 2 or 3. Here's how it works. Step 1, your pituitary gland up in the brain releases FSH. Step 2, this hormone travels down and tells a follicle in the ovary to grow and mature an egg. Step 3, as that follicle is growing, it releases a different hormone called estradiol. And finally, step 4, those rising estradiol levels send a signal right back up to the brain saying, hey, we're doing great down here, you can stop making so much FSH now. It's this incredibly elegant, continuous feedback loop that your body does every single month. Which brings us to our very first specific test, basal follicle stimulating hormone, or FSH. We just learned that FSH acts kind of like the accelerator pedal helping a follicle grow. If your blood test shows that your FSH levels are unusually high early in your cycle, it basically means your brain is having to press down really hard on that accelerator to get the ovaries to respond. A high FSH level can indicate that the ovarian reserve is reduced, which might mean a lower chance of conceiving. But, and this is a big but, please remember, this is just one single piece of the puzzle. It's really just a signal that prompts doctors to look a little closer with more reliable confirmatory tests. It is never the whole story all on its own. And that leads us to the heavy hitter of blood tests, anti-Mullerian hormone, or AMH. Medical professionals consider AMH to be one of the absolute most accurate tests out there for evaluating your ovarian reserve. See, unlike FSH, which can actually fluctuate from month to month, AMH gives a very steady, highly reliable snapshot. Elevated levels of AMH, that's wonderful news. They're associated with a higher number of mature eggs, more embryos if you undergo IVF, and ultimately a higher clinical pregnancy rate. It just gives your doctors a fantastic, clear idea of your overall egg supply so they can guide you the right way.
All right, now we transition from the blood tests over to the visual side of things, the antral follicle count, or AFC. This is done through a transvaginal ultrasound scan. During this, the doctor is literally looking at your ovaries on a screen and counting the tiny resting follicles that measure between 2 and 10 millimeters. Now, each of these antral follicles contains an immature egg. By simply counting them up, doctors get a super accurate visual indicator of how many eggs are currently available in there. And, just as importantly, it helps them predict exactly how well your body might respond to hormonal stimulation medications if you go through treatment.
So what's really interesting about this is how all this data actually serves you. What do these test results indicate in the real world? First off, they predict how your body is going to respond to fertility treatments. Second, they give you a realistic baseline comparing your chances of getting pregnant to other women of your exact same age. And third, they are literally the ultimate empowering tool for your medical team. These numbers are exactly what your doctors use to develop a highly personalized, custom-tailored IVF treatment plan that is uniquely built just for your body. It means your care is as individual as you are. Now, we have to talk about the fact that sometimes the results just aren't exactly what we hoped for. If a test shows an abnormally low ovarian reserve, it does indicate diminished fertility potential. And hearing that, it can be incredibly hard. It is completely okay to grieve or feel upset by that news. But I really want to frame it for you this way. A low result is not a definitive roadblock. It's not the end of your journey. Actually, it is crucial, vital information. It's the compass that guides your care, helping you and your doctor map out the absolute smartest, most effective path forward so you don't lose precious time. So once you have these results in hand, what are your actual actionable next steps? Well, first things first, always sit down and consult with experienced fertility doctors to really understand what your specific numbers mean for your unique situation. If your results show a risk of a premature reduction in your reserve, you might be advised to look into fertility preservation, things like freezing your eggs to protect your future family planning. And of course, these results are going to help you explore assisted conception options like IVF. The main takeaway here is that you get to move forward with absolute clarity and confidence, knowing your doctors are armed with the best data possible. You know, people always say that knowledge is power, and when it comes to reproductive health, I honestly believe that couldn't be more true. Understanding your ovarian reserve completely removes this scary mystery and replaces it with real, actionable medical insight. You are no longer just navigating in the dark. So the final question I want to leave you with today is this. Now that you have these powerful tools and insights in your back pocket, how are you going to use them to write your own fertility story? Thank you so much for exploring this really vital topic with me today. I truly hope you're leaving this explainer feeling informed, hopeful, and absolutely ready to confidently take charge of your reproductive health journey.